Can you do it?
Hmm?
Can you do it?
What?
Send me one.
I did.
Hey everyone, how are you? Good to see you. Thanks for joining. We're just going to dive in here. So the city is up to 7,639 cases since the start of the pandemic, with 153 people who have passed away because of COVID-19. And we're continuing to see a steady number of cases, number of new cases each day, and hoping that we don't see a significant bump after the holidays, and that the cases start to go down. I think the piece of good news, or two pieces of good news, are that the health department's efforts on vaccinations are going well. And also, Dr. Tracy and her team are working to open up schools for pre-K to fifth grade. So I'm going to first hand it over to Director Bond to give an update on vaccinations, and then go over to Rick Fontana to talk about the new testing site. Director Bond.
Thank you, Mayor, and good afternoon, everyone. I hope everyone's staying safe and had a happy holiday. For us, as the mayor mentioned, we continue to monitor the cases. We are also gearing up and have launched our mass vaccination campaign. Many of you participated in that press conference last week. We are happy to report that in 3.5 days last week in our kickoff, we vaccinated 670 individuals that fall under phase 1A. This week, as of this morning, we had 700 already registered for this week alone. We still have the capacity to vaccinate an additional 300 individuals. And so we anticipate to hopefully hit 1,000 by the end of the week. And we ask healthcare providers to please register if you have not done so. Enrollment instructions are available on our City of New Haven website under COVID-19 hub page. And so we want to encourage healthcare providers and first medical responders to make sure you schedule your appointment, and we're ready to assist. We will hopefully get an update this week and announce phase 1B. And once we do that, we will transition into that phase to provide support. So we are looking forward to supporting each of the different phases for mass vaccination.
And just to be clear, because I think the numbers are important. So we initially received 1,000 vaccines from the state. And when Director Bond says we have about 300 left, but we've requested more from the state, and Director Bond, they've agreed to send more. That's correct?
Correct. And so we are picking up an additional shipment so that we can make sure that we have a sufficient supply for the demand.
Great, thank you. Testing updates. So in addition to a number of the regular testing sites that we've been operating, the state has worked with Rick and other members of the city to stand up an additional mass testing site. Rick, can you talk a little bit about that?
Sure. Good afternoon, everyone. In coordination or conjunction with the state of Connecticut, they've opened up a site at our former CVS site, which is over at the former Gateway College. It's on Long Wharf Drive. They actually began. We did a kind of a soft opening on Wednesday, as well as this past Saturday and Sunday. They're fully operational today, Monday through Friday. The hours there are from 8 a.m. to 7:45 p.m. and that is Monday through Friday. And on the weekend, it is also open from 12 noon to 5 p.m. It is a self-administered test, so it's not that long. It's not that long swab that people may be not used to. It's a small swab. It is self-administered, which they hand to you inside the car. It is a full drive-through. There are 4 lanes. The expectation is they can accommodate up to 500 tests. It is a PCR test, which is actually a 24-hour to 72-hour timeline for results. And it's very simple to register. If I could just show you the site. This is actually the site for any individual that wants to register. It's really simple. Register for a test. On the right side of the screen, you can also click it over to Spanish. So it is English and Spanish. So it's very easy to navigate through. It is easier to navigate through as well for utilizing a cell phone or a smartphone. So it's pretty easy. Also, the state is also launching today as well another site. It's ct.gov /priority workforce test. This is another statewide initiative. It's for teachers, public works, preschool, law enforcement, firefighters and paramedics, 911 dispatchers. So this is another way that folks can actually can get tested. I don't have additional information on that site. It was just released very recently by the governor's office. But I can tell you that the site over at Long Wharf is truly going to be a great asset for the city of New Haven. It does prioritize for first responders as well as teachers and those same public works folks, law enforcement, medics, and 911 dispatchers. So this will be a great opportunity for those individuals that need to get tested. There is no cost, and I think that's most of the information that we have as some updated testing that is available here in the city of New Haven.
Thanks, Rick. I appreciate that. And just wanted to underscore again just how important it is for people to proactively get tested. One of the best ways that we get the virus under control is for people to know that they have it. We're seeing a lot of asymptomatic cases. So, and Gage said that he went today and it was pretty easy. So we encourage everyone to do that. It sounds like there's not going to be a lot of lines because of the ability of this site to process a lot of people. Dr. Tracy, you made an announcement last week, and I'm hoping you can give a little bit of an overview of what we're looking like for schools opening up for the younger aged children.
So thank you, Mayor, and good afternoon, everyone. So with what has been happening, and many of you have already had information on some of the decisions that have been made. So in consultation with Director Bond.
Dr. Tracy, do you mind if I interrupt real quick? Rick, do you mind stopping sharing your screen so we can all see each other? I'm sorry, Dr. Tracy. Thank you.
So as usual, we work in collaboration with the health department, and we looked at information, and we realized that we need to set a date for reopening on the 19th. We had set November 9th date, and we delayed that. And the reason why we looked at January 19th for reopening and I would say partial reopening for pre-K through 5, special ed classroom, and newcomers English learners for Barnard and Fairhaven, is that we believe that by that time, we will see a significant decrease in the positivity rate that's going on right now. We also relied on certain research information that indicated that certain population of students were not that impacted by this virus, even through the surge that we've been having. There are other school systems that are still open. There are school systems that are open up even today. Moving forward, we believe it's time for us to allow those parents who had wanted their kids to be in person to get that opportunity to look forward to a date. And so we set this date of January 19th. We also know that we're a little anxious around announcing on New Year's Eve. But the reason we did that is that we did not want information to go out and reach our stakeholders without us informing them first. We didn't want that information out there. So we have consulted a number of stakeholders about these information. When I say consulted, we informed them and fielded questions that they have about that. So we're opening for January 19th for those schools. Now, there are still lingering questions, we know, and we're ready to field the lingering questions that may be out there. We met this morning with all administrators. We met with the schools that are going to be impacted if we are not opening those, because we're not opening two schools in all this. And so we've met with just about all the stakeholders right now except our parents. And we have scheduled meetings for the parents for Quinnipiac and West Rock schools. Tomorrow, 5:30 Quinnipiac and 6:30 West Rock. That's the last stakeholder group that we have to reach out to inform them about what is happening, because those two schools are gravely impacted.
Thank you, Dr. Tracy. If I could add just a couple more details. So we've had our team look into the data that is out there about younger age children. And there's a clear trend, not only in the United States, but in many nations across the world, to open up schools for younger age children, because evidence indicates that they're much, much less likely to spread the virus. And so our approach with this is, while cases are at kind of a moderate high level in New Haven, to ensure that younger children have access to education based on the scientific evidence that exists out there. We're putting together a short document to summarize some of those findings so that parents and teachers can have more of a comfort level, because we know that for all participants in the school system, whether it's teachers, paraprofessionals, or parents, there's a lot of concern about, understandably, about the risks involved because of the virus. And so we're preparing this document to share the evidence that is out there that indicates, actually some of the evidence indicates that schools are safer than where children are now, which is oftentimes kind of moving between different care providers, which may expose them to more potential opportunities to catch the virus. The other thing that's important to underscore is that, correct me if I'm wrong, Dr. Tracy, but families can continue to be remote.
Yes, that's always the option. The governor had already given that option, that families can opt into in-person or remote.
Right.
Yeah.
So any family that wishes to can continue to have their child in remote learning for the rest of the school year. And as far as the buildings, so our COVID inspection team is going to go through the buildings that are pre-K through 5th grade to make absolutely sure that all of the repairs and fixes to potential issues that were previously identified have been completed. So that is something that we're making sure will happen. Can I ask Director Bond just to briefly talk about Quinnipiac School and West Rock School and some of the findings there?
Yeah, absolutely. So as the mayor alluded, the COVID task force team conducted inspections at all of the schools in the district. We were invited by the Board of Ed to do so. What we did is then took the reopening guidance issued by the Commissioner of Education on reopening schools and really developed a platform to be able to conduct these assessments that consisted of a number of safety precautions, of not only signage and social distancing and basic precaution measures, but also looking at the ventilation and the mechanicals around ventilation and safety around that. And so we discovered that, despite those efforts of trying to get school to open safely, both Quinnipiac and West Rock would just need a vast amount of resources to try to get the schools ready to reopening. So we have made the decision collectively to deem them unsafe at this juncture based on the COVID-19 standards that we were looking at.
Thank you, Director Bond. Dr. Tracy, anything else to add, or should we open it up to questions?
Anything else? Team?
Yes, one thing we wanted to make very clear that we are opening for pre-K through 5. Pre-K through 3 will be 4 days a week. Grades 4 and 5 will be operating hybrid, 2 days in, 2 days out, so AABB model. And grades 6 through 12 at this time will remain 100% remote.
Thank you,
So I
Dr.
just want to say it's the first phase. So we're phasing in the hybrid model. So the first phase is this grade level, and then we watch to see where things are, and then we're phasing the other levels that we promised parents. Yes.
Great. Thank you, Dr. Tracy and Dr. White. So let's open up to questions. And Paul Bass is usually the first person to ask a question, but I see Ed Standard has a good strategy for getting the first question by raising his hand right when the press conference begins. So we'll start with Ed Standard.
It wasn't quite at the very beginning, but it was after you're talking about the new testing site on.
A little bit hard to hear you, Ed.
I'm sorry. Is that any better?
Yes, much better.
Okay. Concerning the site on Sergeant Drive, is that open to anyone or just New Haven residents? And what is the priority for people in terms of first responders and healthcare workers versus other people?
Rick, can you answer that?
Sure. Yeah, it is open to anyone, Ed, anyone who wants to receive a COVID test, a PCR test, really just needs to register at the link. I've shared both links in the chat for you. The firefighter, police officer, teachers, those critical workers, they actually, if they come in and there's a line, they show their ID to the individual at the entrance, and then they would be pushed over to the fourth line where there was a small line or no line at all. So it is open to anyone. They just get those critical staff, which I just mentioned, will get priority to get to the front. But we don't expect any waiting at all. The models that they have used so far in Massachusetts have not had more than a 5 or 10 minute wait. And you don't wait for the results like the old CVS. You really just get tested, and they then email you with the results.
Thanks, Rick. And
Thank
any
you.
other questions?
Not right now. Well, could you say more about the two schools that are deemed unsafe? Is it because of the ventilation issues or?
Director Bond.
Yeah, hi, Ed. Yeah, so there was major issues with the ventilation and proper ventilation for what we looked at in regards to safe reopening with the guidance. And so there were some other issues as well, but those are the major concerns with those two schools.
So what will happen to the students of those schools? Will they go to other schools or not, or just stay remote?
I'm going to defer to our superintendent to be able to respond to that.
We're meeting with our parents tomorrow, as I said, Quinnipiac at 5:30, West Rock at 6:30. We're meeting with those families to share with them the plans we have in mind, which includes options for in-person and remote learning. So we'll be getting more information to our parents tomorrow about what we're doing for the students. We already met with the teachers today and have had conversations about what will happen to them. These teachers, many of them will be teaching remotely, those students who have opted for remote learning. And then those who have in-person option, we have a plan for them to enter some form of mini lottery, similar to what we had done for Creed.
Thank you.
Why don't we go to Paul?
Do you want questions just now about COVID or other questions on the table? You want to wait on those?
Let's just do COVID questions.
Okay, just to clarify about the meeting tomorrow night with the parents, is that online or in person?
Online.
Online. And then there's been a lot of discussion nationally about whether to go to reserving the second dose of vaccinations to get more people vaccinated more quickly, way beyond my expertise level, but where are we standing on that one?
So once individuals get their first vaccine, they automatically get an alert to schedule their second vaccine when they're closer to that time frame. So it's all through the VAMS system that we're utilizing. And so thankfully, there's a internal timeline for the alert system to automatically get issued. And so we've been getting individuals already getting scheduled for their second doses. So we are looking forward to supporting that. That was your question in regards to scheduling the second dose, correct?
No, I meant, are we going to pivot the way some communities are talking about pivoting, where we're not going to give that second dose until more people get a first dose? There's sort of this debate going on. It was on the front page of the Times, I think, today, about whether that's a dangerous idea. We should go with the second one to get them fully immunized, or getting more people half vaccinated will get us closer to safety as a community.
So as a community, we're in phase 1A, which is healthcare providers and first medical responders. We don't have a capacity issue with vaccines. It's definitely dangerous not to adhere to the vaccine recommendations, which is to 2 doses, because we want to make sure that we have the proper protection of individuals. So here locally and statewide, we're following the proper recommendations from the FDA and emergency use authorizations, which is the 2 doses that are required for the vaccine administration. And at this juncture, we do not see that there's a burn rate issue with the vaccination. There's definitely enough supply at this juncture.
I just to add to that, I think that decision should not be up to us to make, Paul, because we don't have the kind of understanding that the state and federal government do about the production capacity. And that's probably the main driver, in addition to the distribution, about whether or not it's safer for the community for many more people to get 1 vaccine versus whether there's enough production for many people to get 2. And so my view is that we would not make that decision on our own, that we would look to the state to help guide us on that decision.
I agree. And at this juncture, the state has not indicated any of that.
Other questions, Paul?
Not about COVID.
Okay, we'll come back to you for next round.
Yeah.
Mackenzie, go ahead.
So just 2 quick questions. The first one being, you mentioned that the state is going to be sending some more vaccines. Do we know just how many they're talking about sending to New Haven?
We just received 500 today, and we have arranged to pick up an additional 350.
Okay, so about 1850.
So we have about 700 vaccines on hand, 500, and then so it's about 1,500 total.
Okay. And then in terms of the phasing with the hybrid model, can you just go over it one more time in terms of, I know you said pre-K through 3rd grade, and then 4th and 5th, 2 days in, 2 days out. Can you just break that down and how it's going to continue to phase in?
Okay, thanks, Mackenzie. So pre-K through 3rd grade would come in 4 days per week based on the plan we had initially. And on Wednesday will be asynchronous learning and then deep cleaning day for those, for the schools. 4th through 5th grade will be 2 days per week in person, and the rest are remote. So we are having those coming in AB day, that type of model we're having for those students. Until later on, if we can ramp that up, we will, but we have to look at capacity in schools right now for that to happen.
Any idea when the next phase for that hybrid model will be?
No, we have not yet determined, but it should be soon after. We'll see, depending on what happens. We work with our director of health to see what needs to happen. As I say, always in collaboration to make sure that we're doing what is right and safe for our families.
Okay, thank you.
Thanks, Mackenzie. Kyle.
Hey everyone, I was just curious to know what, at this point, what has changed in the perception of schools? I know New Haven, obviously, we all know hasn't been back, and at one point there was a plan to go back, and then that was reversed. So what makes this point safe or different than others? And are you still, is there a chance that this may not go through as it did before?
I mean, I could take a first stab at that, because we've been talking a lot internally about the health indicators here, which is the main driver for all of these decisions. And throughout the pandemic, we've been learning every week, every month about the virus and how it spreads and how it does not spread. And it's become quite evident that younger individuals have a much lower likelihood of spreading the virus. And that, in addition to many school systems staying open and us having data from those systems about how their cases are spreading, has given us much more confidence that this is a relatively low risk way to ensure that our children have a quality education. I don't know if Director Bond or Dr. Tracy have anything to add there.
Mhm. I think what's important to note that the superintendent mentioned at the very beginning of this press conference is that we're really looking at this as a phased-in approach. We know and have estimated the number of individuals that are going to be returning. We have mitigation strategies in place. We have specific monitoring, containment, and class cancellation plans in place. And so we feel very confident going in that we are going to be working collaboratively to ensure that our mitigation strategies are really going to be executed effectively. And so this phase-in approach is something that we all feel comfortable with at this juncture.
Okay, and then just one quick follow-up question. I know when we covered some of the other districts like Camden and Milford, some of the issues that they were having was the teachers that had to be quarantined. So there wasn't enough staff for the classrooms. Are you guys working on substitute teacher plans or other backups there?
Yes, we are, Mackenzie. Thanks for asking that question. When we were planning to go back in November 9th, we rounded up about 80 subs and we trained them in the models of teaching, how to use Google Classroom, etc. And this time around, thank you guys for helping to send the word out too, that we're looking for substitute teachers. We've given the flexibility of using folks who are not college graduates. We can use high school graduates in this emergency situation to fill into some of those classrooms. So we have a set that we are Miss Mac in HR is going to be, we're working on training them next week sometime to make sure that they're ready to go as we move forward. We also have union subs that we've already had on hand. So some of those are filling in FMLA, family medical leave with some of those teachers. And we just want to make sure that our classrooms are covered. So we'll be practically all hands on deck to make sure that our students are serviced.
Okay, thank you. And one more last question, if I may. Director Bond, we talked to Yale today, and they officials there were having an issue with the delivery of vaccines. They were just saying that they're not knowing how much is coming. You know, it's not matching week to week, which makes planning for them a little difficult. Are you guys running into the same sort of notification issue with trying to figure out how many vaccines you're getting at a time?
No, actually, we're not facing those issues. We were instructed to make sure that we have our vaccines order at a specific date. So we have vaccinated. I mean, we order our vaccines on a specific day by the deadline. There's a deadline that we have to submit into the system, and then by the weekend, we actually get an alert what we're going to be anticipating. So we are always about having a cushion. And we actually thought we had a minor issue. We just contacted the state and make sure that we had sufficient supply. So we actually have not ran into any issues on our end.
Thanks, Kyle. Any other COVID-related questions before we go back to Paul? Paul.
Just one quickie, thanks. As of January 7th, the chief administration officer is leaving and you're going to be looking for a new one. Has there been any thought of combining positions? For instance, having the emergency management chief also serve as CAO, or having the chief of staff also serve as CAO?
I think in general, I can speak for myself. I've been pretty open with finding creative ways to get the job done while also saving money. And the example that we saw in last year's budget was combining Parks and Public Works. I think there needs to be a clear synergy. And it's important to underscore, and goodness knows I've learned this as mayor, that there is an incredible amount of work that needs to get done, and just not the staff capacity to get it done. Ideally, we would be going the other direction and having more staff, because we just don't have the bandwidth to get everything done that we need to. So it's a big decision if we actually were to combine several positions.
Got it. Thanks.
Yep. Any other questions from anyone? Thanks, everyone. So good.